Attention! 10 common signs of cancer that are often overlooked. Imagine if a small, seemingly harmless symptom, like a persistent cough or an unexplained bruise, could be your body's cry for help, a warning sign that could save your life if caught in time. Cancer is still one of the leading causes of death worldwide, but the key to survival often lies in catching it early. Think about the people you care about most. Wouldn't you want them to recognize the signs before it's too late? Cancer rarely announces itself loudly at first. Instead, it starts with whispers, subtle symptoms you might ignore until they become unavoidable. Today, we're diving deep into 10 commonly overlooked signs of cancer. You'll get a detailed understanding of each symptom, why it matters, and the critical steps to take if you or someone you love experiences them. Don't miss this. Knowledge could save a life. 1. Chronic indigestion or heartburn. Description: everyone experiences indigestion or heartburn occasionally, especially after a big meal or spicy food. But when it becomes frequent, persistent, or increasingly severe, it's a warning sign that shouldn't be ignored. Chronic heartburn or indigestion that lasts for more than 2 weeks could indicate an underlying issue in the digestive tract, including early-stage cancer. Why it happens: esophageal cancer, stomach cancer, and even pancreatic cancer can disrupt the normal functioning of your digestive system, causing symptoms such as persistent acid reflux. Stomach acid repeatedly flows back into the esophagus, leading to a burning sensation in the chest or throat. Difficulty digesting food. Tumors in the stomach or esophagus interfere with food passing through normally. Pressure or discomfort after eating. Cancerous growths can narrow the digestive pathway, creating a feeling of fullness or discomfort even after small meals. Curiosity/example. Imagine someone who experiences constant burning in their chest after eating, no matter how light the meal. They begin taking antacids daily, hoping for relief, but the symptoms persist or worsen. What they might not realize is that chronic heartburn could be an early sign of esophageal cancer. Similarly, frequent indigestion paired with bloating or nausea might indicate the beginnings of stomach cancer. Additional symptoms to watch for: persistent nausea or vomiting, sometimes with blood. Difficulty swallowing food, dysphagia, a feeling of fullness after eating very small portions. Unexplained weight loss alongside indigestion. Recommended action: if indigestion or heartburn becomes chronic, lasting more than 2 weeks, and does not improve with lifestyle changes or over-the-counter medications, consult your doctor. Ask for tests like endoscopy, a procedure to examine your esophagus and stomach for abnormalities. Imaging scans, like a CT scan to detect any tumors or blockages in the digestive tract. H. pylori test, to rule out infections that could cause chronic symptoms. Key takeaway: chronic indigestion or heartburn isn't something to ignore. While it's often dismissed as a minor issue, it can be your body's way of signaling something much more serious. Early diagnosis can make all the difference. 2. Difficulty swallowing, dysphagia. Description: struggling to swallow food, drinks, or even saliva isn't something to brush off as a temporary issue. When swallowing becomes painful, feels like food is stuck, or takes more effort than usual, it could be a sign of cancer affecting the throat, esophagus, or even nearby organs. Why it happens: difficulty swallowing, known as dysphagia, occurs when tumors in the esophagus, throat, or stomach obstruct the passage of food. Over time, the tumor can narrow the esophagus, making it harder for food to pass. In some cases, lung cancer pressing on nearby structures can also cause dysphagia. Curiosity/example. Imagine someone begins avoiding solid foods because swallowing feels uncomfortable. They start eating only soft or liquid meals, thinking they just have a sore throat or acid reflux. But this progressive difficulty swallowing can be one of the first symptoms of esophageal cancer or even throat cancer. Additional symptoms to watch for: pain in the throat or chest when swallowing, regurgitating food or liquids after eating, unexplained weight loss due to reduced food intake, coughing or choking while eating, hoarseness that doesn't improve. Recommended action: if swallowing feels difficult, painful, or gets progressively worse, don't wait. Seek medical attention immediately. Your doctor may recommend endoscopy, a procedure where a thin, flexible tube is inserted to view the esophagus and stomach for any blockages or tumors. Barium swallow test, an X-ray after swallowing a contrast liquid to assess the passage of food. Imaging scans, CT or MRI to check for gross pressing on the esophagus or throat. Key takeaway: difficulty swallowing is more than an inconvenience. It's a symptom that can indicate a growing tumor. Acting early can lead to a diagnosis before the cancer spreads, improving treatment options and outcomes. 3. Persistent bloating. Description: occasional bloating after a heavy meal is normal, but persistent bloating, lasting for weeks or even months, can be a sign of something more serious. When bloating becomes constant, painful, or accompanied by other unusual symptoms, it could indicate cancers affecting the digestive or reproductive systems. Why it happens: persistent bloating can be linked to cancers such as ovarian cancer. Tumors in the ovaries can cause fluid buildup in the abdomen, known as ascites, which leads to constant bloating and discomfort. Colon cancer. Blockages caused by tumors in the intestines interfere with digestion, causing bloating and gas. Stomach cancer. Tumors in the stomach lining can slow digestion, leading to a sensation of fullness and distension. Curiosity/example. Imagine someone noticing that their abdomen feels constantly swollen, tight, or uncomfortable, even when they eat very little. They might initially blame it on overeating or digestive issues, but over time, the bloating persists and even worsens. In cases like ovarian cancer, this symptom is often dismissed until the disease progresses to advanced stages. Additional symptoms to watch for: feeling full quickly, even after small meals, abdominal or pelvic pain, nausea or changes in bowel habits, constipation or diarrhea, unexplained weight loss or loss of appetite, fluid accumulation leading to visible swelling. Recommended action: if you experience bloating that lasts more than 2 weeks, especially when combined with pain, appetite changes, or weight loss, seek medical attention right away. Your doctor may recommend pelvic ultrasound to examine the ovaries and detect abnormalities, CT scan or MRI to check for tumors or fluid buildup in the abdomen, blood tests, specifically a CA-125 test, which can indicate ovarian cancer. Key takeaway: don't dismiss persistent bloating as a minor issue. It can be your body's way of signaling something more serious. Early diagnosis is critical, especially for cancers like ovarian or colon cancer, which are often caught late. 4. Frequent fevers or infections. Description: a fever is a natural response to infections, but when fevers become frequent, persistent, or unexplained, it could be a sign that something more serious is affecting your immune system. This is often an overlooked symptom of certain cancers. Why it happens: frequent fevers or infections can occur when cancers like leukemia or lymphoma disrupt the production of healthy blood cells. These cancers weaken your immune system, making your body more vulnerable to infections. The constant effort to fight these infections often causes fevers that don't seem to go away. Curiosity/example. Imagine someone who notices they are getting sick more often than usual, recurring colds, frequent sore throats, or unexplained fevers. They might think they're just overworked or stressed, but frequent infections could be an early sign of blood cancers like leukemia. Additional symptoms to watch for: fevers over 100.4 degrees Fahrenheit, 38 degrees Celsius that happen regularly, night sweats that soak your clothing and sheets, unexplained weight loss alongside recurrent infections, fatigue that doesn't improve with rest, swollen lymph nodes, often painless. Recommended action: if you're experiencing fevers or infections that occur frequently, persist for weeks, or have no clear cause, consult a doctor immediately. Key tests your doctor may recommend include blood tests like a complete blood count, or CBC to check for abnormalities in red or white blood cells. Bone marrow biopsy to detect blood cancers such as leukemia or lymphoma. Imaging scans to look for swollen lymph nodes or other abnormalities. Key takeaway: frequent fevers or infections aren't just signs of a weak immune system. They can signal blood cancers or other underlying issues. Acting early is crucial for a proper diagnosis and treatment. 5. Persistent back pain. Description: back pain is one of the most common complaints worldwide, often linked to poor posture, injuries, or stress. But when the pain is persistent, unexplained, and doesn't improve with rest or treatment, it could be a warning sign of cancer, especially if it's accompanied by other unusual symptoms. Why it happens: persistent back pain can occur when cancers grow near or spread to the spine, bones, or nearby organs, pressing on nerves or tissues. Cancers commonly associated with back pain include pancreatic cancer. Tumors can press on the lower spine, causing deep, radiating back pain. Bone cancer. Cancer in the spine or other bones leads to chronic pain, often worsening at night. Lung cancer. Advanced tumors can press on the chest or spine, causing discomfort in the upper back. Ovarian cancer. Tumors or fluid buildup in the abdomen can cause referred pain to the lower back. Curiosity/example. Imagine someone who develops constant lower back pain that doesn't improve, even after stretching, massages, or over-the-counter medications. They assume it's a muscle strain, but over time, the pain worsens, especially at night or when lying down. In cases like pancreatic cancer, back pain is often one of the first symptoms. Additional symptoms to watch for: pain that worsens at night or doesn't improve with rest. Unexplained weight loss alongside the pain. Pain accompanied by abdominal discomfort or bloating. Neurological symptoms like numbness or weakness in the legs linked to spinal compression. A history of cancer with new, worsening back pain. Recommended action: if back pain persists for more than 4 weeks and doesn't respond to rest or regular treatments, it's time to consult your doctor, especially if the pain is accompanied by weight loss, fatigue, or other unusual symptoms. Ask for imaging tests like X-rays, CT scans, or MRIs to rule out tumors or bone damage. Blood tests to check for markers of certain cancers. A full physical examination to identify possible sources of the pain. Key takeaway: back pain that doesn't go away is more than just a nuisance. It can be a sign of a deeper issue. If it's persistent, unexplained, and worsening, don't ignore it. Acting early can make all the difference. 6. Unexplained bleeding. Description: unusual bleeding, whether it's in your stool, urine, or from places like the gums or nose, should never be ignored. When bleeding occurs without injury or an obvious reason, it could be a warning sign of an internal issue, including certain types of cancer. Why it happens: unexplained bleeding can occur when tumors grow and damage blood vessels or interfere with the normal clotting process. Some of the most common cancers associated with bleeding include colon cancer. Tumors in the intestines may cause blood in the stool, often appearing dark or tar-like. Bladder or kidney cancer. These cancers can cause blood in the urine, sometimes painless and easy to overlook. Leukemia. Blood cancers can reduce the body's platelet count, leading to frequent nosebleeds, bleeding gums, or unexplained bruising. Uterine or cervical cancer. Abnormal vaginal bleeding, especially between periods, after menopause, or after intercourse, can be a critical early warning sign. Curiosity/example. Imagine someone notices blood when they use the toilet, but dismisses it as hemorrhoids or a urinary tract infection. Over time, the bleeding continues, but it's easy to ignore because it's painless. In cases like colon cancer or bladder cancer, early detection often depends on paying attention to these subtle but crucial signs. Additional symptoms to watch for: bright red or dark, tar-like blood in the stool, blood in the urine, even without pain, frequent nosebleeds or bleeding gums, heavy or irregular vaginal bleeding, easy bruising or small red spots on the skin, a sign of platelet dysfunction in leukemia. Recommended action: if you notice any form of unexplained bleeding, especially if it happens repeatedly, see a doctor immediately. Tests may include colonoscopy, to check for growths or tumors in the colon; cystoscopy, to examine the bladder and urinary tract for abnormalities; blood tests, to check for clotting issues, anemia, or abnormal blood counts; pelvic exams and imaging scans, to investigate reproductive organ bleeding. Key takeaway: unexplained bleeding is never normal. Whether it's in your stool, urine, or elsewhere, this symptom requires immediate attention. Acting quickly can help catch cancer early when treatment is most effective. 7. Changes in nails. Description: your fingernails and toenails can provide important clues about your overall health. Changes in their color, shape, texture, or growth can sometimes signal an underlying issue, including various types of cancer. Why it happens: nail changes occur when cancer affects your blood flow, oxygen levels, or immune system, leading to visible changes. Specific types of cancer are known to cause unique nail abnormalities. Lung cancer can cause nails to develop a condition called clubbing, where the fingertips become enlarged and the nails curve downward. This happens due to reduced oxygen in the blood. Liver cancer may cause white lines or pale nails, as liver dysfunction impacts blood supply and protein levels. Skin cancer: melanoma can appear as a dark stripe or streak under the nail, often mistaken for a bruise. Anemia, linked to cancers like leukemia or colon cancer, can cause the nails to become brittle, pale, or spoon-shaped. Curiosity/example: imagine someone notices a dark stripe under their thumbnail that doesn't grow out like a regular bruise. They assume it's harmless, but this could be an early sign of subungual melanoma, a rare but aggressive form of skin cancer. Similarly, someone with lung cancer may notice their nails becoming rounded and curving unnaturally, but dismiss it as aging. Additional symptoms to watch for: nails that develop vertical dark streaks, especially under a single nail; nails that curve downward, clubbing, or feel thicker; pale or white nails, signs of liver or blood-related issues; brittle, easily cracked nails; spoon-shaped nails that dip inward. Recommended action: if you notice any persistent nail changes, such as discoloration, dark lines, or unusual growth patterns, consult a doctor or dermatologist. Further tests might include blood tests, to check for anemia, liver function, or oxygen levels; imaging scans, if lung or liver issues are suspected; biopsy of the nail bed, if melanoma or other cancers are suspected. Key takeaway: nail changes might seem minor, but they can be an early warning sign of underlying cancers or other health conditions. Paying attention to your nails could lead to an early diagnosis, which makes treatment far more effective. 8. Persistent mouth sores or oral changes. Description: a sore in the mouth that doesn't heal within 2 weeks, or persistent changes like red or white patches, can be an early sign of oral cancer. Many people mistake these changes for minor issues, such as a canker sore or irritation from dental work, but ignoring them can delay crucial treatment. Why it happens: oral cancer, which can affect the lips, tongue, gums, or the lining of the mouth, often begins as small sores or patches caused by abnormal cell growth. These symptoms may occur more frequently in people who smoke or use tobacco products, consume excessive alcohol, have a history of HPV, human papillomavirus, a common risk factor for throat and oral cancers. Curiosity/example: imagine someone notices a small sore on their tongue that doesn't heal after several weeks. They think it's from accidentally biting their cheek or eating something sharp, but it lingers, becoming slightly painful. Over time, it might bleed or make speaking and eating uncomfortable. This could be an early sign of oral cancer that often goes ignored until it spreads further. Additional symptoms to watch for: white or red patches inside the mouth, leukoplakia or erythroplakia; persistent sores or ulcers that bleed easily and don't heal; a lump thickening, or a rough spot on the gums or tongue. Pain, numbness, or difficulty moving the tongue or jaw. Loose teeth without an apparent cause. Recommended action. If you have a mouth sore or any oral change that lasts longer than 2 weeks, consult a dentist, oral surgeon, or doctor immediately. Tests may include oral examination, a visual inspection to look for abnormal growths or patches. Biopsy. A small tissue sample is taken from the sore or patch to check for cancer cells. Imaging scans. CT or MRI scans to determine the extent of the growth if cancer is suspected. Key takeaway. Persistent mouth sores or unusual oral changes might seem minor, but they can be the earliest signs of oral cancer. Don't delay seeking help. Early detection significantly increases the chances of successful treatment. 9. Persistent itching or skin irritation. Description: chronic itching or skin irritation that doesn't improve with moisturizers, creams, or antihistamines might be more than just a skin condition. When itching becomes persistent, localized, or unexplained, it can sometimes be linked to underlying cancers. Why it happens. Certain cancers can cause skin itching or irritation due to the body's immune response, hormonal changes, or tumors pressing on nearby tissues. For example, liver cancer or bile duct cancer. These cancers can cause a buildup of bile in the bloodstream, leading to intense itching, particularly on the hands and feet. Lymphoma, a type of blood cancer that often causes persistent, widespread itching due to the release of chemicals called cytokines. Skin cancer. Melanoma or other forms of skin cancer may cause localized itching, redness, or irritation where the tumor is developing. In some cases, the skin may appear normal, while the itching persists for weeks or months. Curiosity/example. Imagine someone with an intense, unexplained itch that doesn't go away despite using every cream and treatment available. Over time, the itching worsens, especially at night, making it hard to sleep. This could be an early sign of lymphoma, where the immune system is disrupted by cancerous blood cells. Additional symptoms to watch for. Localized itching that persists in one area, especially near the abdomen, chest, or legs. Skin changes like dryness, redness, or thickening alongside the itching. Yellowing of the skin or eyes, jaundice, which often occurs with liver-related cancers. Unexplained rashes or small nodules under the skin. Worsening itching at night. Recommended action. If you experience persistent itching or skin irritation that lasts longer than 2 weeks, especially if it worsens at night or occurs alongside other symptoms like fatigue, weight loss, or jaundice, consult a doctor. Ask for blood tests to check for liver function, blood cell abnormalities, or signs of inflammation. Imaging tests, such as an ultrasound, CT scan, or MRI to examine internal organs for tumors. Skin biopsies, if there are localized rashes, redness, or lumps that don't heal. Key takeaway. Persistent itching may seem harmless, but when it doesn't go away with simple treatments, it can signal cancers like lymphoma, liver, or skin cancer. Don't ignore the itch. Pay attention to your body's signals and seek medical advice. 10. Abdominal swelling or fluid buildup. Description: abdominal swelling or a noticeable buildup of fluid in the belly, often described as a feeling of tightness or fullness, can be an early sign of a serious condition. If the swelling doesn't go away or gets worse, it could indicate cancers affecting the abdomen or surrounding organs. Why it happens. Cancers in the abdomen can lead to the accumulation of fluid, known as ascites, or the growth of tumors that cause visible swelling. This is often seen in ovarian cancer. Fluid buildup in the abdominal cavity is one of the most common symptoms in advanced stages. Liver cancer. Liver dysfunction causes a buildup of fluid and pressure in the abdomen. Pancreatic cancer. Tumors pressing against abdominal organs can cause bloating, fluid retention, and pain. Colon cancer. Blockages in the intestines due to tumors can lead to bloating, swelling, and discomfort. Curiosity/example. Imagine someone notices their abdomen is gradually swelling, making their clothes feel tighter even though they haven't gained weight. They might assume it's bloating from food or gas, but the swelling persists, becomes uncomfortable, and even painful over time. This could be a symptom of ovarian cancer or liver cancer that's causing fluid buildup. Additional symptoms to watch for: a feeling of fullness, even after eating small portions; shortness of breath due to pressure from abdominal swelling; unexplained weight gain or loss alongside swelling; abdominal or pelvic pain; visible veins in the abdomen, common in advanced liver cancer. Recommended action: if you experience persistent abdominal swelling or tightness that doesn't improve in a few days, see a doctor immediately. Tests may include ultrasound or CT scans to identify tumors, fluid buildup, or organ abnormalities; paracentesis, a procedure to remove and analyze abdominal fluid for signs of cancer or infection; blood tests to check liver function and look for cancer markers such as CA-125 for ovarian cancer. Key takeaway: abdominal swelling that lasts more than a few days or worsens over time isn't just bloating. It can be a sign of serious cancers like ovarian, liver, or colon cancer. Pay attention to changes in your body and don't delay seeking medical help. Recap: these 10 overlooked symptoms may seem minor or easy to dismiss, but they can be the first clues your body gives about a more serious underlying condition. From unexplained weight loss and persistent back pain to abdominal swelling and skin changes, these signs demand attention. Ignoring them could allow the problem to progress, making treatment more difficult and outcomes less favorable. Think about this: catching cancer early can make the difference between life and death. What might seem like a harmless symptom today could become a bigger challenge tomorrow. The key is awareness and action. Pay attention to what your body is telling you. Now that you know these 10 life-saving warning signs, don't keep this information to yourself. Share it with your loved ones. Awareness could save a life. Like this video, subscribe to Dr. Health for more vital health tips, and remember, when it comes to your health, early detection is everything. Listen to your body, act early, and take control of your health. Your future self and those who care about you will thank you for it. This is Dr. Health, and I see you soon.